So Cathy is a senior research scientist with Friends Research Institute in Los Angeles and associate research sociologist with the UCLA Integrated Substance Abuse Programs and a core scientist with CHIPS. And her research focuses on the intersection of HIV, substance use, sexual identity, and gender identity among high-risk MSM and transgender women. And also, I think, just got a fundable score on a grant that will extend this work, so we're very excited. Congratulations.
Okay, I know we're just about out of time, so I'm going to get through these slides as quickly as possible because we've kept you beyond our allocated time. We heard a lot of discussion about platforms and products. I don't have either. I have an intervention. So I'm going to talk about the intervention that I have for methamphetamine-using MSM, and I'd like to thank my colleagues who worked with me on this project. It makes it a lot of fun when your colleagues are your friends. And I also want to thank the CDC for funding the study. This was a pilot study with 50 active out-of-treatment meth-using MSM, and I am not a Mac person, so, okay, there we go.
Or here.
Which one? No?
There it is.
Okay. I'm going to skip this because we don't have time for it. Let me just say that in Los Angeles, HIV is still a gay man's disease. The majority of the men, majority of the folks with HIV, AIDS, about 84% are MSM, MSMW, MSM who are IDUs. It's a very different disease in Los Angeles than it is elsewhere in the United States or elsewhere in the world, and it's still primarily through sexual transmission with men. The aim of this study was to conduct the formative work to develop a real-time text messaging intervention to reduce methamphetamine use and high-risk sexual behaviors. It was a feasibility study. Again, it was a open arm trial with an open-label single-arm trial with 50 men. It was a short 2-week intervention. The participants needed to identify as male. They needed to have sex with a male partner in the previous 3 months, engage in unprotected anal intercourse with a non-primary male partner in the previous 2 months, have used meth in the previous 2 months, not currently in or seeking treatment, had not learned about a HIV positive serostatus for the first time in the previous 6 months, and then pretty much the other standard eligibility requirements. So the design was, we recruited from October 2008 to May 2009, and those people were screened over the phone. They came in within 2 days for a final screening and a baseline assessment. Of those, 55 were eligible at base, based on their eligibility criteria, and then they had an HIV test. 3 were HIV infected, so not eligible to be in the study. We enrolled 52, had to withdraw 2, and follow-up was at 2 months, and we had a 96% follow-up rate. So the formative stage was we developed 400 text messages. We wanted to send people pre-written text messages so that we would be able to evaluate the intervention and look at a kind of a dose-response association based on the messages. All the messages were based on either social support theory, health belief model, or social cognitive theory. We held 3 focus groups after we completed writing the text messages. And the text messages were all written with our community partners and were primarily written by former meth-using men. And then after the text messages were written, we analyzed them, we put them in by their theoretical perspective, and we had focus groups, with out-of-treatment meth-using MSM, with meth-using MSM who were currently in treatment, and with prior meth-using MSM who had a minimum of 1 year recovery. We had 3 community meetings with our partners that included community social service agencies in the community, as well as government bodies, as well as bathhouse and sex club owners and bar owners. And then we put the text messaging codes by a participant's profile so that if somebody was HIV infected, they would get messages about medication. Somebody who was HIV negative wouldn't get those messages. Somebody who preferred to have sex only in a bathhouse or a commercial sex venue would get messages about going to a bathhouse, where somebody who liked to hook up online would not get those messages. And then we pre-tested the intervention. The procedures, we wanted again to be consistent for the sake of evaluation. Messages were pulled from the participant at any time, but we could only send the messages during the certain high-risk hours that were identified during the focus groups. We sent a welcome message within 30 minutes of enrollment, which basically said, welcome to Project Tech Support. We're glad you joined. And then we would send messages to the participants, 3 messages a day during the first 3 days. And these are if people were non-responders. If they responded, we'd engage in a conversation with them. Days 4 to 6, we'd send them 1 to 2 messages, and days 7 through the end of the intervention, we would send them 1 message a day. We did not want to tax the non-responders. Those that were responders, we engaged in text messaging conversations. We did not exceed 40 messages per conversation. That would be 20 pushed and pulled, again, so that we could standardize the intervention as much as possible for the sake of evaluation, and a maximum of 4 text message conversations per day per participant. Now again, if a participant at the end of a conversation asked us for a referral, we wouldn't abort the conversation, but we would certainly move in the direction of concluding it. Here's our flyer. Here is our website. It was interactive. You would scroll on it, and then there's other messages behind it. And here are just some sample of the text messaging interventions by the theory. So for example, for social support theory, for emotional support, we could say, for example, if he wants it, he'll answer your questions. Health threat, glad you're not PNP, which is party and play, which means to have sex and use meth at the same time. Glad you're not PNP tonight, too much tweak and freak is harsh for your body. And social cognitive theory, self-efficacy, an example is say first thing your pause and always use condoms like you did last time, you can do it. So again, we had 400 text messaging interventions and pre-written text messages, and this is just a sample of a few. I'm doing my best to get through this as quickly as possible because we're so over time. Went through that slide already. This is our participants' profiles. 38% were Hispanic. This, I think, lost some of its formatting when it moved from a PC to a Mac. So I'm having, okay, so about 35% were white, the rest were men of color, just under 60% were HIV infected, the mean age was 36 years, and only 5.8% worked full-time. And you see there was a range of educational attainment with 61% greater than a high school, and there were few that had gone to college. 28% were homeless. Based on the urinalysis, so based on biological markers, we see a decrease in all of the drugs from baseline to follow-up, and we see an increase of no positive drugs. None of this was significant due to the small sample size, but all trending in the correct direction. Alcohol and drug use, now we get into self-report. Alcohol and drug use in the previous 2 months, you can see the decrease in ecstasy, meth, and poppers, amyl nitrate, and all of those are a decrease from baseline to the follow-up. You also see a decrease in the barbiturates from baseline to follow-up, and I believe that is because a lot of people will use the barbiturates when they're coming down from stimulant use. Methamphetamine use from baseline to follow-up, injection of methamphetamine decreased, stopped having unprotected sex while on meth increased, and stopped using meth increased, all significantly. Length of time since they last used methamphetamine, you can see that there was a decrease from the weeks, that it was weeks since they last used meth, and then an increase in that it was months since they last used meth. And in frequency of meth use, again, you can see an increase in less than once a month and a decrease in 4 to 6 days. These are what's circled in yellow are the significant findings. Now, moving to the sexual risk behavior findings, we see a decrease in the number of partners from baseline to follow-up. We also see a significant decrease in exchange sex from baseline to follow-up. And what is really interesting in these findings is when we looked at unprotected sex with a primary and non-primary partner, we saw reductions from high-risk behaviors with a primary partner from baseline to follow-up, but nothing significant. All of the significant reductions were with non-primary partners from baseline to follow-up. And that was across the board, whether we're looking at whether they were a top or a bottom on alcohol or on drugs. Significant decreases in unprotected anal intercourse with non-primary partners, the highest risk behavior. So we're really thrilled with that result. So in summary, the text messaging intervention for out-of-treatment meth using MSM was feasible and acceptable as an HIV prevention strategy. We saw significant reductions in methamphetamine use and high-risk sexual behaviors. The text messaging intervention was associated with fewer high-risk sexual encounters and exchange partners, and the findings support extending this pilot to a randomized control trial to determine efficacy, cost-effectiveness, and sustainability. And as Dallas said, we just heard yesterday we got a very good score, so we're hoping that we will get funded to take it to the next stage. Thank you. I just got through a 20-minute presentation in, I think, 7 minutes.
Yeah. Great job.
Hi, my name is Adam, and really stunning results. It looks very promising. My question is, have you thought about or have you been able to follow up maybe with some more qualitative methods to figure out for whom this works and maybe ways you could improve your model even more? Because in this small sample, right, it works on average, but I was wondering if it might work better for some people and not as well for others, and if you might be able to tailor that even or fine-tune it.
Well, that's always important to fine-tune the intervention. In the RCT, we did not write in a qualitative component, but however, what we are planning to do with this data, we've got a couple of papers out already, and our next one is looking at a dose-response association where we will be looking at which theoretical perspective it was most effective, which text messages they responded to, and we have a file where all of the participants are categorized by a profile of what their serostatus is, the type of sex they like to have, where they like to have sex. So we'll be able to look at who responds to which interventions by their profile, but it's not qualitative data. Thank you.
Hi, I'm Megan Lim from the Burnett Institute in Australia. I just wanted to get clarification on something. You said that you developed a set of 400 standardised messages to send to people, but the messages, when they sent you a message and you replied, were they just individual written at the time, or were they part
That's
of
an excellent question, and that's what happens when you take a 20-minute presentation and reduce it into 7 minutes. I didn't have a chance to get into that. So basically, we trained. We had 4 research assistants who delivered the intervention at different hours, and they were trained on the 400 text messages, and their job during their training was they had to learn these messages like the back of their hand. They had to know all of them, so they would know which one to grab at what time. And they inserted the text messages into extemporaneous messages. And part of what we're looking at is whether there more response to the extemporaneous messages than the standardized messages. What we are finding, I'm in the process of reading all of the transcripts from the text messages, is there was absolutely no way that the participants had any idea whether they were getting an extemporaneous text message or a standardized text messages. The conversations would just flow. When we sent them a prompt, rather than responding, it was always a standardized text message. But in the conversations, they were blended.
So that leads, I'm Debbie Kornman from University of Connecticut. That leads into my question, which is, have you, and I know your sample size is small, but have you looked at if they engaged in a conversation, are they the ones who are more likely to benefit or show reductions than people who just receive these sort of static text messages once off? So
that's exactly what we're going to be doing in the dose response association, is looking at, how many text messages does one get to lead to the reductions in the meth use.
I'm thinking the conversation piece, which is a relationship forming, if that's what may be the critical.
Well, it's very interesting because in my reading of the text messages, so I can't respond on the dose response association yet because we haven't written that paper, but on my reading of the transcripts, they are responding to the standardized interventions. They are starting the standardized text messages. They are starting conversations with just a prompt with a standardized text. And what is really amazing is how many of them, I would say almost most of them, really start opening up and start to develop a relationship with these interventionists that they've never seen, never interacted with, but they are able to, there is so much safety in the anonymity of a text messaging intervention that when I first saw the quantitative outcome data, when I first started looking at the outcome findings, I was thinking, how did we do this in a 2-week intervention? Now that I'm reading the text messaging, I really get it. I see these relationships developing, this sense of social support that's coming through even a standardized message. They're really, when we send them messages based on, for example, social support theory, it doesn't matter if it's extemporaneous or if it's pre-written. They're feeling the support.
Hi, Les Pappas from San Francisco. You may have just answered my question, but I mean, the results are really surprising. They're a little hard to believe.
Yeah.
And
they surprised me.
Yeah, and I guess I was going to ask you, like, what is the essence of it? And maybe you just answered that. Maybe it is just that somebody cares or that somebody is taking, that interest.
It's interesting because when I publish findings from a research study, you publish articles that come from the same sample, but they could be completely different articles. We have 4 manuscripts coming out of this small pilot, and they really work together. and complement one another, and it should be, read together. I mean, we have the formative article that talks about how we develop this intervention, and now we have the primary outcomes article. And what we're working on now are the two manuscripts, one on the qualitative text messaging and understanding what the themes are, and then the final one is the dose-response association. I have a much better understanding of why we achieved these remarkable outcomes with these significant findings after reading the content analysis. After conducting the content analysis and reading these text messages, these guys just opened up.
And I guess the big question which you're going to explore is the sustainability. How do you sustain it? Can you maintain that?
Yeah, and that's what we will be doing in the randomized control trial. Will be a much bigger intervention than this, and which are much larger follow-up points. Okay, thank you. I'll turn it back to Dallas.
Well, thanks, Cathy. And I'm really excited about this study because it's a really relatively simple technology, and it just shows that you don't need to have smartphones or programmers to make something to make some positive impact through mobile phones. I don't know if there are any more specific questions for our group. I know we started a little late to let everybody get in and get settled, and we're ending a little late. But we're going to be here, I think, for a few minutes, probably having a bite to eat. And so if anybody wants to come and engage us in conversation or talk to anybody about potential collaborations or partnerships or see maybe a demo up close, please stay and talk with us. Any other final comments from the panel? No, thank you so much for everybody for coming, and enjoy the rest of your conference. Oh, and I also, actually, before we end, I really want to thank Brett Mendenhall, who you've seen here in the back with the camera, who was really instrumental in organizing and setting up this whole satellite session. Without him, we wouldn't have been able to pull it off. Thanks, Brett.